So I think the health plans are really responding to the market need, both from providers and from patients, that something needs to change. This process needs to be better. So what does the health plan actually have to stand to gain in all of this? Well, number one, they're retaining control of their strategy. They're able to pivot and change things when there's a response to either a regulatory change or to a market demand, and they actually have control back in their own hands to make some of those changes more nimbly and more quickly. Secondly, and probably more importantly, is they're rebuilding some trust with the providers. For a long time, we've put a lot of burden on our providers, a lot of administrative challenges on our providers. The future I see for prior authorization is really that it's functioning as a background, a process in the background, where it's not the center of the engagement a patient is having with their provider. It's something that's happening in the background as a checks and balances, and we are closely getting to the point where that can be true, and that's really exciting. So what does that mean for the health plan? It means that they're actually freeing up clinical resources to do work that demands clinical judgment, and that's what we want our clinicians doing. We want them, putting their time and energy into those more complex cases. We want them being able to reach out to members or to providers to help with coordination of care and making sure that members are getting what they need. And then finally, we are now at the point where we're getting case-specific recommendations at scale that align with clinical evidence. And when you look back to what the original intent of prior authorization was, that's really what the intent was, is to make sure that the members that we're caring for are getting the right care at the right place at the right time. And that is a noble mission. It just needs to be a noble mission that we can carry out without so much disruption. And that's the point in time we're at, and that's a really exciting time to be in.